Have you ever considered how crucial nasotracheal intubation can be in the field of anesthesiology? This procedure, often overlooked, plays a vital role in medical scenarios where oral intubation isn't a viable option. Let's take oral or maxillofacial surgeries, for instance. Here, the oral pathway is often obstructed or needs to be kept clear for the surgical procedure. That's where nasotracheal intubation comes into play, providing an alternative pathway for ventilation and oxygenation. This technique is not just a practical solution in these situations, but also a testament to the versatility and adaptability inherent in the field of anesthesiology. It's a clear demonstration of how we, as medical professionals, can always find ways to ensure patient safety and procedural success, no matter the challenge. So, you see, understanding the nasotracheal intubation process is not just crucial for anesthesiologists, but also for those interested in medical science. So, how exactly does nasotracheal intubation work? Let's begin with nasotracheal intubation through direct laryngoscopy. This technique is commonly used in anesthesia and emergency medicine for securing the airway. The necessary equipment includes a laryngoscope, a nasotracheal tube, a stylet, and a suction device. First, the patient is placed in the sniffing position, which aligns the oral, pharyngeal, and laryngeal axes to facilitate intubation. The nasotracheal tube is then prepared by lubricating it with a water-soluble lubricant to ease the nasal passage. Next, the laryngoscope is inserted into the mouth, pushing the tongue aside to visualize the larynx. The tube, guided by a stylet, is advanced through one of the nostrils, down the pharynx, and into the trachea. It's crucial to advance the tube gently to avoid trauma to the nasal passages. Once the tube is in place, the stylet is removed. At this point, correct placement of the tube in the trachea is confirmed by observing chest rise and fall with ventilation and listening for bilateral breath sounds. Now, let's move on to nasal fiber optic intubation. This technique is often used when direct laryngoscopy is not feasible or has been unsuccessful. The equipment needed includes a flexible fiber optic bronchoscope, a nasotracheal tube, a light source, and a lubricant. Just like with the previous method, the patient is prepared by placing them in the sniffing position. The nasotracheal tube is lubricated and loaded onto the bronchoscope. The bronchoscope is then gently inserted into the nostril and advanced until the vocal cords are visualized. Once the vocal cords are in view, the bronchoscope is advanced through them and into the trachea. The nasotracheal tube is then advanced over the bronchoscope and into the trachea. The bronchoscope is then withdrawn, leaving the tube in place. Again, it's essential to confirm the correct placement of the tube. This can be done by observing chest rise and fall with ventilation, listening for bilateral breath sounds, and using the bronchoscope to visualize the carina, which is the point where the trachea divides into the two main bronchi. In both methods, it's crucial to remember that patient comfort and safety are paramount. The procedures should be carried out gently to minimize discomfort and avoid injury to the nasal passages and larynx. And always remember to confirm the correct placement of the tube to ensure effective ventilation. Also, it's worth noting that while these are the general steps involved in nasotracheal intubation, every patient is unique, and adaptations may be necessary depending on the patient's anatomy and clinical condition. So that's the step-by-step process of how nasotracheal intubation is performed using both direct laryngoscopy and nasal fiber optic intubation. Now that we've walked through the process, let's revisit some key points about nasotracheal intubation. Nasotracheal intubation, a crucial procedure in the world of anesthesiology, involves the insertion of an endotracheal tube through the nose and into the trachea. This technique is commonly used in situations where oral intubation is not feasible or preferred. We've discussed two primary methods for nasotracheal intubation: direct laryngoscopy and nasal fiber optic intubation. The choice between these techniques often hinges on the specific circumstances and patient's condition. Direct laryngoscopy, for instance, is generally the go-to method for most anesthesiologists. It's a technique that's been around for decades, and the familiarity it brings is often a comfort in high-pressure scenarios. However, this method may not always be suitable, especially in patients with limited mouth opening or those with an unstable cervical spine. On the other hand, nasal fiber optic intubation, while more technically demanding, can offer a safer and more comfortable alternative for patients with difficult airways. This method provides a visual guide through the nasal passages and trachea, allowing for a more controlled and precise tube placement. Now let's talk about equipment. No matter what method you choose, the importance of equipment sterilization cannot be overstated. Sterilization helps to minimize the risk of infection, a potential complication that can lead to serious consequences. So always ensure that your laryngoscope, endotracheal tube, and other equipment are properly cleaned and sterilized before use. Speaking of complications, it's worth noting that while nasotracheal intubation is generally safe, it's not without risks. These could range from minor issues like nosebleeds or sore throats to more serious ones like sinusitis, otitis media, or even a perforated nasal septum. There's also the risk of incorrect tube placement, leading to inadequate ventilation or damage to the respiratory tract. Additionally, it's important to remember that nasotracheal intubation requires a higher level of skill and experience compared to oral intubation. This is particularly true for fiber optic intubation, which requires a good understanding of the nasal anatomy and the ability to navigate a flexible fiber optic scope. In conclusion, nasotracheal intubation, be it via direct laryngoscopy or fiber optic intubation, is a valuable tool in anesthesiology. It's a technique that requires careful preparation, meticulous execution, and a thorough understanding of both its potential benefits and risks. Remember, practice makes perfect. As anesthesiologists, it's our responsibility to master these techniques to ensure the safety and comfort of our patients. So let's continue to learn, grow, and strive for excellence in our practice. These key points serve as a quick reference guide to nasotracheal intubation. So, what should you take away from this discussion on nasotracheal intubation? Let's wrap it up by revisiting the key takeaways. Nasotracheal intubation is a vital skill in anesthesiology, a technique that's essential to securing the airway in certain surgical procedures. It's about more than just getting a tube into the trachea through the nose. It's about ensuring patient safety and successful surgical outcomes. We dove into the step-by-step process for both methods: nasal intubation by direct laryngoscopy and nasal fiber optic intubation. While each method has its unique steps and considerations, they share a common goal: a secure, stable airway that allows for controlled ventilation. In the direct laryngoscopy method, remember the importance of proper equipment preparation, patient positioning, and tube insertion. It is a method that relies on visual guidance and manual dexterity. On the other hand, nasal fiber optic intubation, often used when direct laryngoscopy is challenging, involves the use of a flexible fiber optic scope. This method requires a slightly different skill set, including proficient manipulation of the fiber optic scope and a keen understanding of the anatomical landmarks. Key points to remember include the importance of gentle handling to prevent nasal trauma, the need for adequate lubrication, and the critical role of patient monitoring throughout the procedure. Remember, it's not just about getting the tube in place. It's about ensuring the patient's safety and comfort at every step of the process. It's also worth noting that while this discussion provides a solid foundation, mastering these techniques requires practice and experience. It's through hands-on repetition, under the guidance of experienced clinicians, that you'll truly become proficient in nasotracheal intubation. Remember, nasotracheal intubation is a vital skill in anesthesiology. It's a complex process, but with understanding and practice, it becomes a crucial part of ensuring patient safety and successful surgical outcomes.